Hi, Kendall Peterson, the Cash Whisperer here. Today we're going to talk about alternative pain management and some of the techniques that go along with that. One of the things that people don't know is that the major research hospitals like the Mayo Clinic and MD Anderson have been looking at complementary and alternative pain management techniques for a while now. And so I thought we'd go through some of those. The first one, the first alternative pain management we're going to look at is essential oils and aromatherapy. And a lot of people just think that's like, oh, let's smell this pretty candle. But actually what they do is they take essential oils out of plants and they either apply them to the skin or they inhale them. But a lot of times they apply them topically. And that's where they get a lot of the benefits from that. So this dates back thousands of years. They've really played an important role in the medical systems of the Chinese, Indians, Egyptians, Romans, the Greeks. And so today it's one of those alternative treatments that's used for a variety of conditions. If we look at another alternative pain management practice, it's chiropractic. And even though it's kind of a mainstream option and you have insurance companies paying for it and that sort of thing, it's still technically complementary and an alternative medicine. And what they do is the chiropractors look at the relationship between the structure and the function of the body in order to decrease pain. What their main focus is the spine for most of them, and most chiropractic visits involve manipulating the spine and adjusting it to realign the body, which promotes self-healing. Another alternative pain management practice is massage therapy. And while a massage feels great, there's other also time-tested benefits from it. And one of the things that it does is when you manipulate the body's soft tissue, it influences the muscles, the circulation, the lymphatic systems, and the nervous systems of the body. And so it's one of those things that's really more than just feel good, beneficial. It actually has some health issues that go along with it. Biofeedback and relaxation therapy is also another alternative pain management practice. And basically what that is, that's a technique that teaches the patient to consciously affect systems that are normally involuntary, like your heart rate, your muscle tension, your blood pressure, things like that. And the idea is that when you become fully aware of those, then and how they correlate to pain, you can adjust them in accordance. One of the theories behind it, there's not a whole lot of conclusive research, but one of the theories behind it is that we know that stress affects our body, and we know that stress affects our health too, and will increase your pain levels as your stress goes higher. And because biofeedback and relaxation therapy helps you relax, that in turn is one of the things that helps reduce the pain levels than the symptoms that you see. And the last alternative pain management practice we're going to look at is acupuncture. And this is an ancient Chinese healing art. It's been around for between 3,000 and 5,000 years. The practice involves inserting hair-thin needles into various points in the skin, and what it does is it regulates the movement within the body's meridian system. And recently in their lab, a company called Ciara has been able to isolate these vibrational characteristics that you get from acupuncture, and they've been able to program holographic chips that have an adhesive on the back to interact with your body the same way, essentially giving you the benefits of acupuncture without the needles. In a double-blind clinical trial that's been published in a medical journal, they had an 83% of the people who used the Ciara holographic chips received significant relief from their painful sensations and symptoms that they had. So, if you want to find out more about that, about the Ciara holographic chips, you can go ahead and click the link below, and it'll take you to the science page, and you can read up about that on your own. Until next time, we'll see you later.